Client assessment, lateral view. So Barbara is standing sideways, and you just want to stand and look at her, especially her spine from the side. So let's start by looking at the head, and we just want to make a note if our client has a head that's slightly forward, is it straight in line with her spine, or is it slightly tilted backward? So Barbara's is pretty centered. There might be a little bit forward head, which most of us have. Most Westerners have a little bit of forward head. Barbara looks like she's in a pretty good line with her spine. So then we'll look at shoulders. Are the shoulders rounded forward, or are they pretty neutral? And again, Barbara's got really good posture. I see just a little bit of rounding up here that might indicate just a little bit of weakness here and tightness here, which is super common. Then we'll look at the curves of the spine. So we'll start with Barbara's cervical spine, and we want to see lordosis here. So there's a place on your paper to mark whether it's extreme lordosis, it's normal, middle, or if it's pretty straight. You can see that Barbara's neck has just a good lordotic curve, natural curve. Then we'll start to look at thoracic spine. And with the thoracic spine, we want to see a little bit of kyphosis. Right? Barbara's back is pretty straight right here. Barbara, again, has good posture. I can feel her shoulder blades sticking out of her back a little bit. So I might work with Barbara a little bit on some upper back strength. And then the lower back, we want to see a little bit of lordosis here. We just want to notice if this client has extreme lordosis, a really flat back, or even a rounded spine. So Barbara's got good lumbar lordosis. Is that it? Oh, pelvis. Let's look at pelvic tilt. All right, so to check pelvic tilt, I'm going to have Barbara, let's have you face the front, and let's have you make the diamond with your hands. So we want to place the thumbs on the navel and the fingers just above the pubis, and then what we want is the fingers and the thumbs in a straight line. So if Barbara had an anterior tilt, I'm going to stick here to turn the side. Yeah, turn sideways and just show a little bit of that, what that would look like to have an anterior tilt. Then her fingers would be inward and her thumbs would be outward. And then a posterior tilt, her fingers would then be in front of her thumbs. Okay, so, yep, just like that. And so what we're looking for is that nice straight line, and that tells us that the pelvis is in neutral.